Who is it?
It's Danae.
This is a story about how I went from living my dream life at the time to being bedbound on two separate occasions and eventually needing brain surgery. And now I have started over at 35 and am a nursing student. So this might take a few parts, but bear with me. I'll get through it as quick as I can. But people have had questions about my journey, and I just thought I'd finally sit down and share it. So basically, everything started with the pandemic in 2020. At that point, I was really active. I was doing personal training. I was working out nearly every day. I was in really good shape. That was my way of coping with the stress of the pandemic. I ended up getting a back injury that took me out of exercising for a little while, but otherwise, like everything was good. At that point, I was living in South Carolina, and then I ended up getting a job in 2021 that had me relocate to DC. Things were going well. Like I was living in DC. I love DC. I loved my new job. I was working with amazing people. I was doing work that I was really passionate about and that I really loved. But I noticed that I wasn't able to be as active as I was used to being, despite the injury and everything. At that point, I was getting winded from walking. I was drenched in sweat from doing nothing. I just felt like really at the time what I thought was like I was just out of shape. I was really deconditioned, and I just chalked it up to like going from being really active to not as active because of the injury. But things just progressed. I started having night sweats and these weird like neurological symptoms, like my arms and my hands would go numb. I would get like foot drop almost, where like I couldn't like lift my right foot. It kind of dragged when I walked. I gained a lot of weight out of nowhere. Like I couldn't, it didn't make sense with like how I was living my life, even though I wasn't active, like as far as like working out regularly, but it didn't match up to the weight gain that I was experiencing. I started retaining a lot of fluid. My legs would swell up. I would have pitting edema. And just everything got very weird. But I, again, just chalked it up to like not being as active and then the stress of the job because I was extremely overworked. Even though it was work that I loved, at the end of the day, I was sacrificing too much of myself for the sake of the job. I wasn't sleeping properly. I was working way too many hours. I invested too much of myself in the work that I was doing. And I figured that that stress was just adding up and contributing to some of the symptoms that I was experiencing. So over time, over like the course of a year, things continued to progress. Things got weirder and weirder. I developed pulsatile tinnitus, which is where you hear like this whooshing sound in your ear. Tinnitus is typically like a ringing sound in your ear. Mine was like a whooshing sound that kind of went along with my heartbeat. And at that time, I went to the doctor about it. They referred me to ENT. I got hearing tests done. Everything was normal. I think they were questioning if it was related to like high blood pressure because at the time I also had like was having spikes in my blood pressure. Like normally it would be fine. Like I was checking it regularly day to day. It was fine. Sometimes it would jump up and like at the doctor's office it would be high. And I was like, well, maybe it's just white coat syndrome. So they had me do a few scans. They looked at like my jugular vein, and I think I got a angiogram of my brain as well to look at the arteries, and everything was fine or it looked normal. They wanted me to do a sleep study to see if it was related to like sleep apnea or something, but I never ended up doing that. I just lived with it because again I was too busy. And then my mom got diagnosed with cancer, and so I was back and forth between DC and South Carolina helping out with that. And then I ended up staying in South Carolina for a while and taking a leave from work so that I could help my mom get back and forth to cancer treatments. And it was like as soon as she finished her treatment, my body went haywire. Like the weird things that I was experiencing was exacerbated by 10. I started having shortness of breath, air hunger, heart palpitations. I noticed that when I would go from like sitting to standing, I would get super like lightheaded and almost pass out. I never fully passed out at that point, but things just kept escalating, and I was becoming more and more unable to function regularly. And it got to the point where I couldn't get out of bed. Anytime I got up, my heart was racing. Like I remember going from like lying down, my heart rate was like 70 to standing up, and it hit 140, like just literally from standing. And so I ended up going to the ER because I had a really bad episode, and they didn't really do anything because everything was kind of episodic. You know what I mean? Like it was when I'm there, I'm sitting down, so nothing's happening. But when I'm active, when I'm moving, that's when things would get weird. But I also was having these episodes where it's like I would be fine, and then I wasn't. I would like lose the ability to move. I would end up on the ground. I never fully passed out. Like I never lost consciousness, but I would like lose the ability to move my limbs. My body would start shaking. Tears would fall from my eyes. I wasn't like crying, but tears would fall from my eyes. My heart rate would be sky high. My blood pressure was stroke level high, like 200s over 150s. Like it was extremely high. And I never really got answers for that. One scary moment was I went to take a shower and my heart rate spiked to like 185. That was the last readout because I was wearing an Apple Watch at the time and tracking my heart rate. Because when I would go to the doctor or to the ER, they would be like, "Well, is anything like causing it?" Like I was trying to pin down what I was doing when things would start to go haywire. So I was wearing an Apple Watch and tracking my heart rate, and I was in the shower, and I couldn't. I got out. I sat on the side of the bed. My heart rate hit like 185, and then I passed out. And this was like the one time that I did. Like my body, I went from sitting up to being flat on my back, and I felt buzzing all over my body. I couldn't move. I couldn't speak. I could hear my mom talking to me. She was freaking out. She called EMS. I'm like sprawled out on the bed. They tried to take vitals, and they were just like, I don't know, I think it's my cuff. Like I think something's wrong because my blood pressure was so freaking high. They didn't want to believe it, so they just kept retaking it. And so they get me to the ED, and by that time, whatever I was experiencing had subsided. So I ended up getting like a heart monitor and seeing a cardiologist. I went through a slew of tests. My echo, where they looked at the structure of my heart, that was normal. I did a stress test that came back abnormal. It showed that I had ischemia, but sorry, I get so frustrated like reliving this because this just kept happening. So the stress test results showed that like when I'm active, I have cardiac ischemia. I don't have enough blood pumping to my heart. But instead of believing the test results and looking further, the cardiologist was like, "Oh, well, it's probably just like a false positive or whatever. Like it's probably not a true result because you have breast tissue and the results can be skewed by breast tissue." And I'm just like, what a sexist, unreliable test then. But also, what if it's not my breast tissue and it's actually something wrong? And turns out it was something wrong. So we did the stress test. He also gave me like the tilt table test to test for POTS. I pushed for that because he was like, "Well, your heart monitor came back normal. Like I had like a few PVCs, like a few abnormal like arrhythmias, but like nothing alarming." And again, like I was laying down when I had that joint on because every time I get up, I'm about to die. Like I feel like death. And so I felt like it just wasn't an accurate measure of what was going on with me. And they also put me on medication to slow my heart rate. So I'm like, if the medication is treating the problem and we're having a monitor on to detect the problem that the medication is treating, how are we going to actually find anything? But what do I know, right? What do I know? Anyway, so I went through like that testing. I ended up getting a diagnosis of POTS from that cardiologist, but it was begrudgingly. He was like, "I don't really know if you have it for real because during the tilt table test, you never actually passed out." And the people who have POTS and who know anything about POTS, you know how frustrating that is because you know you don't have to actually pass out to be diagnosed with POTS. I had everything else, like my heart, I had the change in heart rate and everything. So anyway, I got the diagnosis. He put me on metoprolol, I think, to start. It wasn't helping. So we played around with it for a little bit to kind of get a right dosage to help, but it didn't really do a great job. And the idea was that it would help, like, uh, it would help. This is POTS. Like, my brain goes blank sometimes. The idea was that the metoprolol would help stabilize like my heart rate. It would keep it from spiking so high. So that's all I got from that doctor. I ended up going back to DC because again, at the time I was in South Carolina helping my mom with her cancer treatment. So that was done. My health I had some answers. And so I went back to DC and things were okay for a little while, but I was never back to my full baseline. After a while, things just continued to escalate. I kept having these random moments where I would just pour down in sweat. My heart would be racing. My blood pressure would spike, and I didn't know why. And I was having more and more like neurological symptoms. My memory got really bad. My speech got really bad. Like my ability to like recall words. I would lose myself in my thoughts. I almost burnt down my apartment multiple times because I was trying to feed myself and would forget what I was doing. Sorry, I'm getting emotional. I would be standing in the kitchen lost, like very much confused about where I am, what I'm doing. Or I would put something in the oven and forget I did that until the house is smoking and the fire alarms are going off. So I saw another cardiologist in DC, and I'm very grateful for him because he was like, "I don't know anything about POTS, but I know people who do." And so he referred me out to spot POTS and dysautonomia specialist through Johns Hopkins. And I am very grateful for that cardiologist who could recognize the limitations of his knowledge instead of telling me that it was all in my head or it's not a thing. Because that referral, I think, saved me in a lot of ways. So I get the referral to Johns Hopkins, and these are dysautonomia specialists. They have a facility where they run all types of tests to figure out like what is malfunctioning with your autonomic nervous system. And I went through all the tests, and there were a lot of things wrong. So I had issues with my peripheral nerves. I wasn't sweating properly. The POTS was again confirmed because of the tilt table testing. I had tests that showed that I had some demyelination going on, like there was damage to my the neurons in my brain, and another test showed that I actually had cerebral ischemia. So not only did I have multiple tests that showed that like my heart isn't getting enough blood, but also my brain. But those tests really just confirmed the dysautonomia, right? It confirmed the POTS. It confirmed that like my autonomic nervous system isn't functioning properly. They switched the medication that I was on. One was they changed my beta blocker because metoprolol wasn't working, so they put me on Betaxolol. Life changing, love it. I would take it every day for the rest of my life if I have to, with no complaints. But they also put me on another medication that treats like myasthenia gravis. It's supposed to like help excite your nerves to get your like muscles to your nerves to fire more, essentially, because that's what some of my symptoms were kind of looking like. But that medication was horrible for me. I mean, I would take it and I literally felt all my neurons just firing, and I would lose my speech again. I would get slurred speech really badly. My eyes would be twitching like crazy. And it was just like all the bad side effects. My tongue would go numb. Like it was just really bad. So I stopped taking it, but the Betaxolol was working, so I kept taking that. The issue came because after all those tests that like kind of wrecked my autonomic nervous system that was already pretty wrecked, it triggered some things. Like things got worse after all the testing. And anybody that knows anything about like neuro stuff, like I was failing all of the cognitive tests. Like my Romberg test was positive, so like I lost like my coordination was terrible. I closed my eyes and I couldn't walk. My coordination was bad. I had on and off muscle weakness. I couldn't remember anything. And I think after those tests is when I started having seizures. And those also escalated. It went from being like a one-off to happening more regularly. And the sad part of it was like I thought that I finally had doctors who could help me, but they felt as if it was outside of their scope. So outside of the dysautonomia and the POTS, that's where their treatment, I guess, stopped. And so I was back in this like space of an unknown of like I have one diagnosis and understanding of one thing that's going on with me, but there's something else happening and I don't have anyone that can help me or treat me. And so things again kept escalating. But no one believed me. I would go to the hospital because I'm having seizures and I don't have a history of seizures. And there's limited, if you're not actively dying, there's not much the ER can do or will do because they're not going to diagnose you. They're not going to treat you. So I was kind of in this like gray space of like, I'm having these emergent things happening to me, but it's not happening in the moment that I'm in the facility. And I don't have a neurologist. I was trying to get in to see a neurologist. It was impossible to get in to see a neurologist. Things were escalating quicker than I could get in to see. I didn't have the time to wait. But yeah, I ended up with like a few overnight hospital stays. They did a few tests to check for MS. I didn't show any like lesions, and so they weren't concerned about MS anymore, or like in that moment, they ruled out MS or multiple sclerosis. They wanted me to come in to the clinic. They gave me the referral. I tried to get in. It was like 3 months wait. I again just kept having these seizures, and it kind of came to a point where I had a doctor's appointment because I had to get set up with a new primary because my old primary changed facility. She went to a different practice, and so I had to get a new primary before I could get a new neurology referral. So I was on my way to my doctor's office, and I felt the same feeling before I had a seizure the last time. And so I was like, oh shit, like I think I'm gonna have a seizure, and I'm driving. So I called my mom on FaceTime, and I was like, I think I'm gonna seize. Like, I don't know what to do. She was like, pull over. And I was like, but I'm right here. So I made it to the parking lot of the doctor's office, and I never made it out of the car. I started seizing. while on FaceTime with my mom in the parking lot. And she had to find my location. She called the doctor's office to let them know I was in the parking lot seizing. Um, they came out, they ended up calling EMS. I go to the ER and they give me Keppra. This was the first time I got medication for seizures. And I think at that point they gave me another referral for neurology. Um, but my family was so concerned, given like the cognitive state I was in of like forgetting things, almost burning things down. I can't drive. My family came to DC, packed up my apartment, everything in storage, and moved me back down to South Carolina. I got some approval from my job to kind of work remote at the time while I figured it out. I think I took medical leave at that point too. Um, and yeah, I was in South Carolina from that point on. So like the referral from the ER with the Keppra wasn't really helpful because I was no longer in DC. So I was back in South Carolina and I was trying to get a referral, get in to see a neurologist in South Carolina. I ended up having multiple seizures while there. One of which I stopped breathing. My mom called 911. She actually found me. I was at home. I was at my sister's house. My mom and my sister live in the same town, but my sister's house is closer to my mom's job. I don't think my sister was there at the time. My sister's house is closer to my mom's job, so I stayed at my sister's house during the day just in case something happened so my mom could come to me. And I felt like something was going to happen, so I FaceTimed my mom. And she left work, came to my sister's house, and kind of found me on the ground seizing. EMS came. By the time they came, I was kind of recovering. I got to the ER. They put me on like I forget what it's called, but to monitor my brain activity to try to catch the seizure. I never had one while I was there, so they discharged me with a neurology referral, which is fine because that's what I needed anyway. A few days passed, and I'm still taking the Keppra, but I'm still having these seizures. Some time passes, and I am at my mom's house. I wash my hair. I remember washing my hair, and I just felt this intense, sharp, like stabbing pain on the right side of my head. And next thing I know, like I was on the phone. I was on FaceTime with my sister, I think, because again, I was like, something fell off, and the pain happened. And while I'm talking to her, my speech goes. I'm slurring. I can't find my words. My mom comes and she's like, my entire affect was different. I had this like childlike demeanor, like I wasn't rooted in the current reality. It was very weird. Um, my speech was weird. I kind of was weak on my right side. Um, yeah, my speech was weird. My affect was weird, and my mom was so scared. Um, she took me to the ER. Sometimes it's quicker, like being in a more rural area, to just drive to the hospital than to wait for EMS. So she took me to the ER. They started doing a stroke workup, but then I swear the doctor went and looked at my chart. And I forgot to mention this. The last ER visit, the doctor made it seem as if everything was in my head. He said that I said that I was having this dissociative out of body experience, and I never said those words. He made it. I think he even put like a conversion disorder or something. Basically, that like I was having these psychological episodes and that it wasn't actually real, and I was hyperfixated on like symptoms and making things worse. I ended up reporting that doctor. Like I called like a patient advocate to kind of see what I could do. They looked into it, but at the end of the day, nothing was done about it. I felt extremely dismissed. I felt like because I was a woman, because I was black, because I was a black woman, that I wasn't being taken seriously, and that it was just automatically assumed that it was just psychological, like it's hysteria, it's just like hormones or whatever. Um, and so the second time when I came to the ED, and by all accounts, it looked like I had a stroke. Um, they started the workup. They brought in a neurologist, I think, on a monitor because there wasn't one in-house. So it was like on a computer monitor, doing like a remote neuro exam. And they decided that it was not an actual stroke, even though there was no imaging done. They decided that it was psychological, like the original doctor suggested. But they kept me. Me and my mom kind of had, well, my mom, because I could barely speak at that time. Like my speech was still very distorted, very slurred. I was speaking in a foreign accent. Like I just felt like my brain wasn't working, and it was terrifying. But they ended up keeping me. They hooked me up to like the monitor again to try to kind of catch a seizure or something. The doctor at that time suggested maybe a spinal tap to see if it was some sort of like meningitis or infection or something that could have been causing the symptoms. We were down for it, but he was like, we should just wait until like you get transferred to the bigger hospital, where they have more resources, because there's like a limit to what we can do here and what we can even test for. So like even if we do the spinal tap, it's a possibility that you would have to get it done again because we can't do everything here. So it's like, all right, cool. So we were waiting in the ER for I think like 2 days for a bed to open up at the bigger hospital. And at that time, I told my mom what to do in the case of my death. Because not only was I experiencing the scariest thing I've ever experienced in my life, but I also knew that I was being cared for by providers who did not believe me. And I knew the data, I knew the statistics, I knew what research says happens to Black people, to Black women in healthcare when they aren't believed. And I was living it. It had already happened. But I knew that what I was experiencing was real, and I knew it wasn't psychological. I knew something was wrong and they were missing it. And I genuinely felt like they wouldn't believe me until it was too late, until I was dead, until permanent damage had been done to my brain. And yeah, so I told my mom what to do in the case of my death. I told my family that I love them and I apologized in advance for the trauma that this may cause them. And we ended up getting transferred to the bigger hospital. The neurologist there, the nurse there told me that the neurologist was really good. I spoke to him initially and we were relieved because he seemed to be curious. He wanted to figure it out. He was like, I'm gonna look through all of your things, all of your chart and everything, and we'll figure it out. They connected me to like a 72-hour EEG. I think this was called, like for the brain activity to try to catch the seizures or whatever. But then the next day he came in and he was basically saying like, this is all in your head. We're not going to use the word seizures anymore because you're not having a seizure. You're having a psychological non-epileptic seizures. And we're not going to use the word seizure anymore because that's not what you're experiencing. Also, you don't actually have POTS either. Your doctors don't believe that you have POTS. So that's not even a real thing. And this is likely caused by your trauma from being in the military and all that you've seen. And I also, was a kid that was beat by my parents, and that gave me anxiety. And I once knew this person in med school who was convinced that she had every disorder that we learned about, and that stressed her out. And so like that can explain what you're experiencing too. And again, at this point, we were still doing the EEG. No scan had been done of my brain. And I was being fully gaslit because I know what my dysautonomia doctor said. I've seen the reports myself. I know what I'm experiencing. And I know the trauma that I've experienced in my life. And I also know that having an acute response like I was having to trauma that was very much old, it didn't make sense. I had a therapist at the time. I've been working with this therapist for like 3-4 years. We were doing trauma therapy. She even said that like, this isn't a trauma response. Like it doesn't make sense. Like we've done so much work. Like we were actually talking about ending therapy because I had come so far. And I told the neurologist, I advocated for myself, and I was like, I want these tests done because these other tests show that like I have some sort of cerebral ischemia. I know what it feels like when this is happening to me. I feel like I'm not getting enough oxygen to my brain. Like I feel like I'm not getting enough blood to my brain, and that's when these things happen. I said that like I flat out disagree with what you've said. I don't agree that this is trauma related. I'm actually offended that that's what you would say. Um, and even people with trauma can still experience physical and physiological ailments that's not related to their trauma. So like I just rejected the whole thing. And he was like, well, I can run the test, but I don't ever even look at those results. Those results don't even mean anything. But if you want it, we can run it. I wanted to have I think it was an angiogram or like an MRA. I wanted an MRA to look at the arteries in my brain to see like if I was actually getting blood to my brain properly. I forget the results. I think it showed like some sclerosis, but not significant. Also, I forgot to add that like when I was in the ER one time before, I had like a CT or something done of my head, and it showed that like my sella, which is where your pituitary gland sits, like was partially empty. So it showed that like my pituitary gland was partially flattened. And it showed something else. I think it also pointed to like the ischemia or something, but I can't remember what the results were. But anyway, I had like a history of these imagings and reports that showed something going on, but it was never significant enough. Everything could be like incidental finding. You know, that's the words they kept saying, like an incidental finding, a false positive is not significant enough to cause these issues. And so, yeah, like I ended up, and the neurologist was like, kept telling me to stress myself out while I was hooked up to the EEG. He's like, keep the lights on, despite me complaining of like a headache every day that I was in that hospital. Keep the lights on, stress yourself out, like don't be in here relaxed. And he wanted me to stress myself out to induce a seizure. But I was like, at no point of the previous seizures was I stressed out. So why would like stress, emotional distress or whatever cause one now? And I remember the nurse saying, this is so weird. Like I've never seen them tell any patient to stress themselves out or to keep the lights on or to go about it this way when they're here with like your type of symptoms. She was like, I just don't believe that this is in your head. And this is another reason why I knew that like this was the time of my life for me to go to nursing school, because that nurse came in and asked me, what is your goal for the day? And I was like, I don't know, like I have no idea. But then I thought about it and I was like, no, I want to actually have a conversation with a neurologist and tell him like that I disagree with him. Like I want to advocate for myself. And she wrote it on the board and she was like, I'll be here so and make sure that you have that conversation so you can advocate for yourself. And she was like the only person around me that believed me. And every step of the way, it was always like a Black woman nurse who actually believed me that something was going on. So, long story short, I ended up getting discharged from that hospital visit. Nothing really came of it. I did get another neurology referral. But I didn't go initially. Like I wanted to find someone else because the referral that I had was at the same practice that neurologist from the hospital worked at. And I was like, if he's like this, there's no reason for me to believe that like I'll have a better experience with one of his colleagues. But I ended up going because I couldn't get in anywhere else. So I went to that appointment. I explained the things that were happening to me. That neurologist decided to give me an at-home EEG where I could have the things hooked up to my head, monitor my brain activity for like a week or something. I forget how long it was, but like they had like video recording me at night. I was hooked up during the day. Like I had to stay in like one spot, two spots the whole time. And we would see if they could catch anything. An important note is that like with these EEGs, it doesn't rule out whether or not you have epilepsy or if you're having epileptic seizures. Only thing it can do is confirm that you have an epileptic seizure, you have epilepsy, or you had an epileptic seizure if it catches you having an epileptic seizure. And so like they were misconstruing like what the test actually is and what the results were, because they would say, well, nothing happened, so you don't have this. And I was like, well, nothing happened, so how do we know I don't have this, you know? But anyway, I ended up doing that test. That neurologist, I had a follow up with him after the results came in. He was like, yeah, well, I also pushed to have another brain scan, but this time I asked for MRV, I think it was, to look at the veins. And so the EEG came back, nothing was caught, nothing happened while I was hooked up. And so he was explaining that to me, and then we went over like my brain scan results, and he was like, I mean, it just shows that like you have an empty sella, so like, but that can be like an incidental finding. A lot of people have that. It doesn't really mean anything. And you have like, I think at that point he also found like one of my major veins was like stenosed. It was like damn near closed fully. He was like, well, that really doesn't mean anything either, like unless you're like having headaches or something. And I was like, bro, I've been telling y'all this whole time, like I've been having the worst migraines of my life. Like at that point when I was bedbound again, because whenever it would rain, I would be sick, like in the bed, unable to move, unable to function, could not do anything. The light was killing me. Like I would have to wear shades all the time. I would just get these really bad headaches where I couldn't function, and it was impacting my work because like if I get a headache, like I have to lay down, like I can't do anything. Um, so yeah, this was right around the time that I had put in my notice at work because I was convinced that like these doctors aren't going to find anything. They're not going to help me. And I knew that I couldn't function anymore. I couldn't. My job was mostly remote. It required me to think a lot. I was doing policy analysis. I was running an office. I was responsible for other people. I needed to be able to advocate for those people. I needed to show up and do my job, and I couldn't do it. And I also couldn't be in DC anymore because it was no longer safe for me to live on my own. So I put in my notice at work and I said goodbye to my team. And I did so under the assumption that like this was my new normal, that I would just be sick in bed, miserable, unable to function until I was no longer here anymore. Um, and this was like the second time in 2 to 3 years that I was in that position. Because back when like, the pot stuff started, I was also in the bed, unable to envision a future. But this time was different because it wasn't just physical. Like with POTS, I just physically couldn't do it. This was cognitive. I was losing my brain, my ability to think and speak. And as someone who's from a lower income area and household and family who emphasize the importance of education as a means to escape that, at that point in my life, my brain saved me so many times. It was why I ended up in DC with this great job in the first place. It's why I had 2 degrees. It's why I traveled the world. It's why I've been able to enter spaces that I was able to enter, and why I could expand my horizons. And my brain was my saving grace. And what I was going through was taking that away from me. And I felt like it was one thing to live a life where I was physically incapacitated, or I physically couldn't, do and show up in the way that I would like. That was one thing. That was one thing to try to wrap my head around and deal with. But losing my brain, my ability to think, to analyze, like I would lose my ability to navigate this world. And I knew I didn't want to be in a world where I was both physically incapable and mentally incapable. And so I knew one way or the other, either this illness was going to take me out or this illness was going to take me out. And so yeah. So anyway, I once again had to advocate for myself because the neurologist was dismissing the results once again. But I was like, no, actually, I do have headaches all the time. That's one of the biggest reasons why I'm here in this office. And also, like, now it's showing that I have a fully empty cella when before I had a partially empty cella, so that's progression. And why are we just going to ignore a stenosed cerebral vein? Like, why are we doing that? And so I was like, no, I don't actually want to just accept that. I want to explore what that could mean. And he was like, well, we could do a spinal tap to see if your intracranial pressure is high and kind of go from there. And I was like, yeah, let's schedule that. And I hear him outside in the hallway talking to one of his colleagues about like the fact that he was going to order the spinal tap and was talking about my results. And the colleague was like, he was like, I could tell the colleague didn't think it was necessary because he was like, I mean, I don't know, it might not be this, but she does have this and they does show this, so I guess it's a possibility. And so fast forward, they schedule the spinal tap. I go get it done, and mind you, they're putting this massive ass needle in my spine, right? So they do it, and in the process of it, out of nowhere, the tinnitus stops. The pulsing in my ear that I've been living with for like 3 years was gone. And come to find out, my intracranial pressure was more than twice as high as what it was supposed to be. So basically, I ended up diagnosed with idiopathic intracranial hypertension, or IH. So basically, my body was not reabsorbing my cerebral spinal fluid properly. So I had a buildup of cerebral spinal fluid in my brain, in my head, and it was putting pressure on my brain and causing all of these issues. So like there's usually there's your brain, there's a thin layer of cerebral spinal fluid, and then there's your skull. Because there's the skull and this is the brain, and the skull isn't going to expand. So the more the fluid built up, the smaller my brain was getting. That's what that CT showed. It showed atrophy of my brain. My brain was shrinking, but nobody wanted to explore why. So, because the spinal tap showed the increased pressure, plus the imagery showing what it did, I got a referral to a neurosurgeon. I wanted to get in at a specialty clinic in North Carolina, I think, but the process was like very convoluted. And I looked up the surgeon that I was referred to, and he was like the best in the state. So, and I could get in quicker with him. And so I just went with it, even though at that point I did not trust that hospital system anymore, because across multiple hospitals, inpatient and outpatient, no one believed me. And so I was very skeptical about working with the neurosurgeon at the time. But the initial consultation went well. He showed empathy. I didn't have to convince him that something was wrong with me. And that was reassuring. That was refreshing. And so we scheduled the surgery. Well, we had to have I had to do what is it called? Basically, they had to take a catheter from my groin to my brain to kind of measure the pressure, like again, but internally, to see if the stenosis in the vein was enough to warrant the intervention. So I had that procedure done. I was awake while they were fishing a catheter in my brain, and that was so intense. It wasn't fun, to say the least. Yeah, they confirmed at that point that it was IH, that I was a good candidate for stenting. So we scheduled the surgery. I ended up getting the surgery like 2 days before Christmas. They asked if I wanted to wait to get like past the holidays, and I was like, I would rather be recovering from this surgery during the holidays than sick from the symptoms of this condition during the holidays. So we scheduled it. They got it done. I think I had to stay in ICU for like one night afterwards, and then I was discharged. And recovery went kind of smoothly. It was like maybe a week of like kind of it being intense because I still had like headaches. I could like feel the stent. But overall, like my life completely changed from that surgery. I haven't had a single day where it was as bad as it was before the surgery, since the surgery. I haven't been debilitated by the rain anymore. My neurological symptoms have resolved. I still have POTS. Like I still have to take the medication for POTS because I still have like the blood pressure. The heart rate spikes and everything, and I get winded if I don't take the medication. Like POTS is still a thing. But the treatment of the IH gave me my life back. And I went from planning my funeral with my mother to making a 5-year plan for my future. And so I had the surgery in December of 2025, and I started nursing school at Emory in May of 2026. And so I just finished my first semester at Emory, the #1 nursing program in the country. And I keep saying that because it means so much to me that like I'm at this institution, because a big part of why I applied is because I felt like I actually deserve this. Like I deserve to be trained by the best. I deserve to learn from the best. I deserve to be trained to be the best. Because I want to be the best like provider I can be. I obviously nurse, but like my plan is to go further. Like I want to be as impactful as the nurses who helped me. And I felt like I wanted to ensure that happened by being at the best place, you know? And on top of that is I went from losing my ability to think, literally couldn't think, couldn't speak, couldn't remember, to earning a 4.0 in my first semester of nursing school at the best program in the country. And so like, I don't want to be on the internet crying, but that is like so amazing to me because It's been so hard. I went through so much. Like, it's literally a miracle that I'm even here today, because I genuinely think that, like, had I not advocated for myself, I probably would have stroked out. I probably would have had permanent brain damage. I, I probably could have killed myself or someone else because I had a seizure on the road, even though the doctor was telling me I'm not having seizures. Like, it could have looked so different. But I'm here and I'm healthy and I'm thriving and I'm thinking and I'm understanding and I'm remembering. And with this voice that I am blessed to have again, I'm going to keep advocating, not just for myself, but for other people who look like me, who have similar experiences as me, who keep getting kicked in the cracks of this broken healthcare system. Because we deserve to be believed. You deserve to be believed. No one should go through what I had to go through to get care that they need. And yeah, that's my story. And this is a very long video. I don't know how I'm gonna break it up, but that's my story. That's my why. That's why I went so hard. I went so hard this semester, but not just in the sense of like I made nursing school my life, or like I was up all night. I didn't do any of that, because I also learned my lesson. I learned the hard way of what it means to overextend yourself, to sacrifice yourself in the service of a dream. And I refuse to do that this time. I'm not going to do that this time. I'm taking care of myself. I eat well. I sleep regularly. I haven't pulled a single all-nighter. I don't even believe in those. Like, I'm gonna get my at least minimum 6 hours of sleep, with ideally more, but sometimes like I just can't sleep, and that's just who I am. But I study, I do my readings, I pay attention. I mean, I might not go to every single class because I'm human, but yeah. And I've met some amazing people. I've met people who who want this, who understand not just like, not even my story. We all have our own individual stories. We all have our own things that we've been through, that we've had to overcome. It might not be health related, but we all have our things, right? We all have our personal whys. And I found people who are very much rooted in their why, and who aren't taking this opportunity to be here for granted. And they give it their best, but they also take care of themselves, and they look out for the people around them, and they clap for the people around them, and I clap for them. And yeah, I'm beyond grateful. I am beyond blessed. Um, yeah, so that's it. That's how I went from thriving, living the dream, to being bedbound and needing brain surgery and starting over in my 30s, to now being a chronically ill girly who's in nursing school at 35. I'm going to post this despite me feeling very much a way about crying on the internet. But we ain't gonna talk about it no more. We ain't gonna talk about the crying no more. We ain't doing this no more, okay? But yeah, that's it. Thanks for listening, watching. Thanks for the love that I've already gotten. Yeah, if you have any questions about POTS or IH or the surgery that I had, if you're going through that too, anything, nursing school, let me know. I'm here for it. And again, it's Danae. Thanks for being here.